Hi ladies, it's Valerie. It is VEDA day 2. It is late at night. It's 10 o'clock. I'm tired. I have been going all day. I worked, of course, and then got home at like 6:15. We had to rush right back out the door to get over to our final Bradley class, which was really fun. And I'm just exhausted, but I am coming on here. I'm trying to be dedicated. On my list of things to do, the agenda for today is a review of the water birth class that we took in preparation for a birth. The hospital that we're birthing at, you do have to take this course. You have to receive a certificate, which they gave us on the night that we took the class. They also did a tour of the facilities, and so yeah, it's pretty basic. It was like a 25-minute class. They had like PowerPoint presentation, which is where, you know, the PowerPoint slides came from. So yes, I'm all over the place. It was pretty straightforward. The goal obviously is for a positive outcome for you and your baby through water birth if possible. And they're there to help you achieve the goal. In the city that I live in, there are 2 hospitals that allow water laboring and births. There is one birth center in our state, and that is 4 to 5 hours away from here. So this is our option with our midwife group, and so we want to obviously have that as an option. So I do want to do a little bit more outside research on water birthing. I've of course seen videos, and I would just like to learn a little bit more about it. This was just kind of a general course. Benefits for the mom. I'll just read through these. Warmth, comfort, support during labor, ease of movement, possibly fewer contractions and more effective labor, relaxation is increased, bonding with the father and the baby. I'm not really sure why water birth increases that. Supports tissues of the perineum, so it helps minimize the risk of tearing, having that warmth on there. The benefits for mom continued are greater comfort and pain relief in labor and birth. It reduces the sensory stimulation, and it increased patient satisfaction. So what that means by reduces sensory stimulation is not that you will not be able to feel what's going on, what you need to do, but it will kind of lessen just the pain, you know, of having that warmth and that just soothing water environment. Benefits for baby is a more natural transition, immediate bonding with parents, a warm, familiar environment, oftentimes less traumatic birth, and there's less light for them coming into the world. Disadvantages and risks they list include difficult to monitor fetal well-being and labor progress, which at our hospital's case, they do have one wireless, waterproof, I guess, fetal monitor, one of those belts. However, my practice and myself, I prefer to have as little interventions as possible. I would like to only have fetal monitoring that is intermittent with a Doppler, so that would be probably every 15 minutes, an hour, and they're able to, you know, to put the Doppler wand in the water and monitor the baby as needed. Can be difficult for a support person to give counter pressure, risk of fetal aspiration, which again, fetal aspiration is unlikely to occur. It's rare, I believe, because what causes them to have that reflex to take that first breath is when they hit the air. The air triggers that first breath response, and they've been breathing the amniotic fluid. So again, I want to look into this a little bit more, but that is one of the risks that they list. Risk of infection, which again, I'm not sure exactly why that's listed. Difficult temperature regulation for baby, which again, that was listed as one of the benefits, was that they would, you know, have a warm, familiar environment. So, you know, again, I'm not sure. These are things I want to look up, so I'm just kind of telling you what we've learned. Slippery baby, which I think that they're slippery either way. Difficult to intercede and assist with intrapartum complications, which would probably include like hemorrhaging and things of that nature. But part of those risks, part of the next couple of slides, talks all about the eligibility and the policies at this particular facility, so that you can prevent as many of those as possible. And so, some of their eligibility and policies are that, you got to be a pretty uncomplicated pregnancy, and you have to be approved in advance by either your midwife or your OB. Again, you need to request it upon admission to your hospital. Let's see. But you have to have taken this course for this particular hospital that we're going to. You have to have taken the course and have the certificate in hand when you get to the hospital. Your water birth will be attended by your doctor, your physician, your midwife, whoever. Oh, excuse me. No interventions will be used in the birthing pool and tub, such as episiotomy, vacuum extraction, forceps, which again most people are trying to avoid that. So no question there. Let's see. This video is kind of going along because I'm very slow right now. It basically just talks about, following instructions. If someone asks you to get into, or, not into, but out of the tub for any reason, you need to do so. It's all within reason. I think that they just have to, again, kind of protect themselves. It just talks, again, a little bit more about the hospital's visitation policy applies. Let's see. I think that's really pretty much it. You do have to have a reactive fetal monitoring strip or negative contraction stress test before entering the water. They want you to be on the monitor for at least 30 minutes with a good tracing before they allow you to get in the water. And at this particular hospital, they have the little blow-up tubs that they use, and they use like one of those liners. You get your own liner. It's disposed of after each time, and the pool is cleaned each time, after every use. You can't have any untreated communicable blood or skin infections. Any sort of infection, active genital herpes, HIV, Hep B antigen, or positive Hep C antibody, no open wounds, no bleeding greater than bloody show. Just all, like I said, pretty much common sense type of stuff. Sorry if this is like the most boring video ever because I am so tired. They want you to be, full term, at least 37 weeks. You can't have any suspected macrosomia, which is a large baby, usually indicated by, the doctors say, gestational diabetes, fetal distress, malpresentation. You can't have any, these are contraindications. No Pitocin, no abnormal fetal heart rate monitoring strip. You have to be in active labor. And again, any sort of medications that you take will kind of offset that as well. Obviously, epidurals you can't, preeclampsia, and any other conditions subject to the discretion of your doctor. Suggested supplies that you bring would be like a little kid floaty inner tube, small float, use it as a backrest or a pillow, bikini halter top if you want to be covered. Use cold washcloths if you're feeling too warm. Use a variety of positions to help the baby descend and rotate. Alternate, the tub with other labor tools, walking, sideline, rocking, other comfort measures. So again, just pretty standard stuff. I hope this wasn't completely boring, but yeah, basically that's it. They talk a little bit more about, you can deliver the placenta in or out of the tub. That's basically it. They just review their policies and review being in the tub. So I'm going to have to do a little bit more research just to answer a few of my own questions and just to find out. But that is my review of the particular hospital facilities class that we went to. Very straightforward, simple, to the point, not very super informative, but that's about it. So I'm going to end this. Thank you so much. Good night. Hi ladies, it's Valerie. It is VEDA day 2. It is late at night. It's 10 o'clock. I'm tired. I have been going all day. I worked, of course, and then got home at like 6:15. We had to rush right back out the door to get over to our final Bradley class, which was really fun, and I'm just exhausted, but I am coming on here. I'm trying to be dedicated. On my list of things to do, the agenda for today is a review of the water birth class that we took in preparation for a birth. The hospital that we're birthing at, you do have to take this course. You have to receive a certificate, which they gave us on the night that we took the class. They also did a tour of the facilities, and so yeah, it was pretty basic. It was like a 25-minute class. They had like PowerPoint presentation, which is where, you know, the PowerPoint slides came from. So yes, I'm all over the place.